Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Sanjula Jain, Ph.D., SVP Market Strategy and Chief Research Officer at Trilliant Health. Sanjula, welcome to the show.
Great to be with you, Matt. Thanks for having me.
So, Sanjula, it's great to have you back on the show. It's always nice to have a repeat guest. So, as you know, I always like to kick off by giving you a chance to give more introduction in terms of who you are and what you do. So, in case folks don't remember you from last time, the floor is yours.
Sure. So, I'm really a health economist, health services researcher by training, but kind of what I think sets me apart is that I really think about all things applied research. So, my career really has been focused on working with the decision makers that really underpin the entire health economy. And so my research, the guiding question is always, what do I think the key questions that decision makers need to know or need information to answer to be able to kind of work us towards a better healthcare system? So I like to basically bridge the rigor of academic research, if you will, with the day-to-day hustle and bustle of all the things that health system leaders, life science leaders, payers, everyone who's doing the hard work of running healthcare needs to be thinking about and try to, get everyone thinking ahead, 10 steps ahead, right? What trends are coming down the pike?
Yeah, so it sounds like kind of just bringing a lot of curiosity into the approach and getting people thinking about issues from a different perspective.
Yeah, and we may have talked about this in the past, but one of my pet peeves is really around not to get down in the technicalities of research, right? I don't expect busy executives to really be researchers, right? But I think as an industry over the last 20 plus years, we've really been primed to consume, I'm going to call it more superficial information, right? We don't really question the rigor of it or, what it's actually representing. We just kind of take a lot of things at face value. And so my main objective really is to get people to think differently and say, okay, well, if you're reading a headline, is that representative of the country? Is that representative of one particular organization, one market, or is that someone's opinion, right? And when you really start unpacking the layers, and I live this every day and working with executives, I'm sure you do too, is I hear people make a lot of assumptions that are factually incorrect or rooted in very flawed data. And that may not seem like a big thing, but when you compound that over time, you start realizing, wow, a lot of the kind of base information that executives are using to guide their strategies is flawed. And I don't think anybody would argue that the US healthcare system is not very good, right? So maybe there's something we can do to kind of rethink all the things and our baseline assumptions about the healthcare system.
And that kind of raises a great point and leads me into a different form of a background question, because obviously usually I ask, what got you into healthcare? And I think we covered that last time. So kind of picking up on what you were just talking about, what puzzled you the most about the healthcare industry in the US?
Yeah, so I think, and I should preface by saying that I, have some Canadian roots. So I do think a lot about, other healthcare systems as well. And, there are pros and cons in every healthcare system, right? So I don't think there's one gold standard. But the thing that puzzles me the most is how the healthcare industry, unlike any other industry we have in the US economy, defies the laws of economics, right? Like whether it's airlines or, I was just reading an article this morning about Uber, right? When supply and demand fluctuate, we see changes in prices that correspond, right? We see that with groceries, right? But in healthcare, we just don't follow any of that, right? And somehow this huge industry has managed to defy it. And what do I mean by that, right? There's many examples, but the kind of the most macro level example is generally, if you look at the history of the US health economy, right? Demand for services has actually been flat to declining, right? And we could unpack that at a later time, but it's actually been going down, whether you look at that from, inpatient hospital admissions, for example, right? So demand's been going down, yet we see prices are going up, right? Like steadily. And so there isn't this kind of, that's defying the laws of economics where, in theory, you would see some movement in price, but if any, more trending downwards, but we're actually going upwards. And so we're basically we charge whatever prices we kind of want in healthcare with very little justification or explanation, and we get away with it, right? It's not like, Costco, right? Like we don't have any trust in the healthcare system of I'm going to get the best deal or the best price in whatever service I'm going to get. Most people's perception as consumers or patients is, where am I going to get ripped off today? Or am I really getting, charged the right amount? So it's just the basic econ 101. Like, how does healthcare of all industries get away with it and defies these laws when, most other industries can't?
And so kind of thinking about that, how is the healthcare economy working, and, kind of what is that current state of it that, and from your perspective, kind of what is driving it in either a positive or a negative direction at the moment?
Yeah. A lot of people call me negative Nancy, but I'm just looking at the facts. And so, what I see is the inputs into the US health economy, right, are growing. And so a key metric of that, I should say, is spending, right? The spending curve has been up and to the right for years, and there's been really no bending or downward trajectory of that. So we're at about $4.5 trillion today, and the estimates are projecting that to continue growing, right? And you can attribute that spending growth to a lot of different things, right? Administrative, labor, technology, innovation, increasing access, insurance, whatever you want to call it, right? But that is the ultimate metric, is spending. And from a kind of qualitative perspective, if you will, I also view inputs into the healthcare system, right? Today, compared to 10 years ago, we have more options for Americans than ever before when it comes to their healthcare, right? Like you're not just going to your doctor's office anymore, right? Now you can do the telehealth, you can go to retail, you can go to outpatient, there's so many more options available, right? And I would view that as an input into the system that we're working on. Output, well, so my question is, what do we actually have to show for that input? And, in basic business terms, basically, what is the ROI for all those investments we put into the US health economy? And from where I stand and all the data that I look at, when you really think about it at the health economy level, we see that our health outcomes, right, the health status of Americans is not just bad, it's actually deteriorating, right? Like it's getting worse year over year, right? It's not just that like we've been kind of generally bad for a while, like we're seeing in real time, we can talk more about this, but the thing that really concerns me is that younger Americans, for example, are sicker than they've ever been before in our history, right? Like that's just not something that we've seen. So we're seeing some material shifts in health status. And so long-winded way of answering your question to say, how are we doing? I don't see the ROI for all the inputs we put into the healthcare system, and the outputs we're getting are not just, neutral or bad, it's actively going down, right? So the curve going up and to the right and the other curve going down at the bottom. And that, to me, that's the heart of the US healthcare system. And I don't think we talk enough about that.
So as you're pointing out, like cost is increasing, which is, kind of disassociated from, as you said, the outcomes that are being achieved. So, what are a few of the particular factors that you've identified in your research that you think are kind of driving that, unexpected, or I don't know if unexpected is the right word, but that divergence where you've got two results that are completely disassociated with each other?
Yeah. I think one of our findings, and it's actually public data, which once again, I think there are a lot of things laying out there in plain sight that we haven't connected the dots around. The thing that really has shifted is that we're seeing an increase in administrative costs, which is basically on par now with care delivery costs, right? And so, this will be an unpopular opinion, but generally the question I would pose to everyone is, how much of that is actually just waste, right? Like, how much of that is unnecessary? What are we getting for that? All that administrative kind of fat, if you will, whether you want to put that to documentation and all of that. One thing we talk a lot about in the trends report this year is around value-based payment and quality reporting, right? There's so much money invested into quality reporting, right? And, we could have a whole other conversation about what that's resulted in terms of mortality and the fact that, half of hospitals don't even fully report. But, right, there's a lot of data out there about the amount of money we spend on trying to comply with some of these things. So I think that is a big kind of component that is just kind of sitting out there. And there's probably a lot of dimensions we could unpack there, but I would really throw out there administrative costs, which is different than just labor costs, right? I think everybody's been hiding behind this labor piece, but when you look at this longitudinally, that is kind of one piece. And so if we're spending almost as much as we do to deliver care as we are to just do kind of the supporting system, if you will, like that seems like something that we should maybe double click into and figure out, okay, how do we actually bring down some of that?
Yeah, that's a great point, because you said, you're pointing out, it's, if the admin costs are, almost about equal with the care delivery, that's diverting a lot of resources away from the activities that can actually produce better outcomes and start to, bring the two lines together of cost and outcomes. So it's, kind of, I was very intrigued by, as you pointed out, that, kind of the value payments and the quality reporting seem to be a factor in that. So, I would like to double click onto that, because, as you probably well know, value-based care and those initiatives have been promised as the way to get healthcare back on track. But it feels like on that administrative side, we're not getting there. And that couples along with, just that general feel that value-based hasn't really been adopted the way it's been promised.
Yeah. I mean, value-based payment is very near and dear to me, because that's actually the first topic, I did as kind of formal research as part of my PhD dissertation, right? So I've been tracking value-based payment trends and adoption and outcomes for about a decade at this point, right? And so with any new innovation, new program, right, sure, there is that initial wave. We are now well past that. And so, I think the things that are getting overlooked, there's a lot of literature on there about, what are the factors that are hindering adoption? And maybe it's, technology and interoperability. So let's focus on all these things. Once again, that's more of a, in the weeds view, right? That's an operator view. When we look at the health economy level and really zoom out, okay, first things first, what is the actual mechanism structurally of value-based payment incentives, right? What is it doing? At its core, it's really just reallocating dollars. It's not actually reducing total expenditures. Like that's kind of one critical piece of this, right? And we tend to overlook that a lot. Second, we're still a predominantly fee-for-service kind of health economy, right? And so, at some point we have to ask ourselves, okay, not only why are people not adopting it, but if it's not working, should we think about something else? What is our ultimate objective? Mortality has not actually improved. It's gotten worse, right? That we talked about quality reporting as a key dimension of these value-based mechanisms, right? So everyone kind of focuses on all these kind of granular metrics of, here's how we're improving in our organization. But when you zoom out and you look at the quality distribution, there's very little movement year over year. And you think about all the money that individual organizations in these contracts are spending to participate, and then they're not actually reducing the health economy level spending, right? They're just trying to figure out how to maximize the amount of money reimbursement that they can ultimately get, right? So it's just a lot of red tape to recirculate dollars, but we've actually put more money into the program in terms of the administration pieces you have to do to participate, but we haven't moved the needle on the spending curve, right? And so really the question should be, why don't we think about a different construct, right? What if we actually thought about, like other industries, the concept of value for money, right? How do we incentivize people to actually compete on delivering value versus doing a bunch of administrative complexity to comply to a construct, right? Once again, that construct, value-based payment, is focused at the provider level. It's not actually focused at the ultimate customer level, right? It's not actually that the consumer or the patient doesn't see the impact of value-based payment. They don't know the difference. Am I seeing a doctor in a value-based payment contract or not? Is it changing the amount of money I spend? It doesn't roll down to them at all, right? But in a value for money construct, right? Let's take another industry, for example. I think a lot about, hotels, right? So We all know Marriott's a brand. Within Marriott, there's, different tiers, sub-brands, right? And tiers of hotels. The Courtyard Marriott is going to be very different than the Ritz-Carlton, right? Matt, would you disagree with that? Like, do you expect to pay Courtyard Marriott prices for Ritz rooms and service and quality?
Yeah, no, I think that's a great point. As you said, it's, that tiering sets different expectations.
Right. And so in healthcare, we don't have any of that, right? Back to the pricing, like we don't actually know what we're paying for. And what I'm seeing in the data, like at the punchline is, in many cases, we are actually paying a premium price for worse quality and worse experience, right? It'd be a totally different story if we are paying a lot of money, but actually doing okay, right? Or people were neutral, or we're seeing some improvements, right? But we're seeing the polar opposite, right? We're seeing this downward trajectory. And so when you actually plot quality against spend or cost or price, right? Like you don't see that relationship in the way that you should in a value for money kind of construct, which is how principles of economics and business practices and consumer goods all work. And we all talk about wanting to be consumer centric in healthcare. Well, let's start with that. So to me, value-based payment, back to your question, it, definitionally even is not actually structured in a way that's achieving the goals that those policymakers intended it to have, right? And we've now had many years under our belt of seeing it. And, at some point we have to say, for the amount of money we are spending to comply to this program that not even everybody's participating in is costing us billions more than we are saving. Maybe we should stop throwing more money at the problem and think about another solution, right? And think about something else. And we don't do that in healthcare. We just keep focusing on here, throwing more money at it. It's not getting any better. And that goes back to the administrative waste.
Yeah, and I think kind of the implicit in that is there's a lot of institutional inertia when it comes to healthcare. And for those of you just joining, I'm talking with Sanjula Jain from Trilliant Health, talking about kind of trends in the healthcare economy, and just focusing a lot on value-based care and kind of picking up on that. What you're pointing out, Sanjula, we've had a lot of these different models where the results are mixed at best. So I think we're starting to go in the direction of some of those are driven by statute or regulation. So have we missed opportunities, or are we having stagnation because everyone's just aiming at an old legal-based goal? Or where are the opportunities for advancing and learning from those lessons?
I think this goes back to kind of what we talked about at the very beginning around like theory and practice, and kind of my mission around academic rigor and the realities of the business world and how things operate, right? How do you run a hospital? And I work with a lot of esteemed academics who underlie a lot of these policies, and I used to be in this camp, right, where I used to come up with these idealistic things that it all sounds great on paper. But I think when we really look at the facts and look at some of this data, you start realizing that these things are not designed in a way that are intended to have, the impact we're shooting for. And once again, I think it goes back to the laws of economics and what outcomes are we trying to achieve. Something may sound good in theory, but when you actually play it out in practice, it's a totally different ballgame, right? So we could talk about a completely different example. I mean, we were taught, early in Health Policy 101, basically that monopolies in healthcare, that they increase price. Okay, well, you start unpacking that now. When you actually start seeing, when you look at the data of what hospitals and providers are actually getting paid from the payers, you see a very different story. We actually see that on average in certain monopoly markets, the kind of median negotiated rate for a certain kind of service is actually lower than many competitive markets. So in a nutshell, without getting super wonky on this, that is new information because there's new data that is now kind of entered into the healthcare system, right? And that is health plan price transparency data, which was afforded by the Transparency and Coverage Initiative, right? So for years, we didn't have that information available. There was this big information asymmetry, right, with the payers and the health insurance, company, right? That was kind of this big black box. So we're out there making assertions at the policy level about pricing and monopolies when no one actually knows what is United or Anthem paying the provider, right? They didn't have those facts, but we were making those assertions. Well, now the payer data is now available, right? And this is a very new dynamic. So when you start looking at that, you say, wow, the things we've been talking about in terms of the M&A policy and regulation don't align with the actual facts, right? And so, I'm not a M&A expert, right? But that's kind of the starting point. And so I think there's a lot of things that we could look at and say, these healthcare policies, I'm not saying they're not well intended, don't get me wrong, but are they actually achieving the goals they set out to achieve? And are we looking at data that actually helps us understand, not in an operational lens, but systemic impact, right? What impact is it having on the patient or, the consumer, even at the health economy level? How is it affecting outcomes or spending? I mean, those are the ultimate metrics, right? And I think when we talk about quality, there's tons of papers out there around like, we improved on this particular metric and this, and I'm not saying those aren't important, but at the end of the day, what's the one hard thing that affects, our status? Mortality, right? Like that is kind of an undeniable fact. And when we see that US mortality is actually getting worse, like it kind of supersedes all the little intermediating kind of factors, right? So I think we tend to just be very tunnel visioned in how we've been evaluating and slicing and dicing these things. And what our research has been trying to do is really, get people to zoom out, right? And try to connect the dots between all these little pieces and think about, the upstream or the downstream, the kind of the metrics that really matter. And if you're thinking about hundreds of metrics, you're going to miss the signal from the noise, right?
Yeah, so maybe this helps to bring it around full circle, but as you said, trying to sort out all those metrics from the noise and really parse it out. And I think kind of embedded in what you just said was mortality ends up being one of those key factors because ultimately that is indicative of the overall quality of the outcomes. And then early on, you were talking about how we're still talking about like the same size pie. It's really just figuring out different ways to divide it up. So maybe this starts veering just into a theories perspective, but is it necessary to start shrinking that pie to force a readjustment and rethinking on how to improve outcomes so you can start to bring those diverging lines together that probably should have not an inverse, but a correlative kind of function to them?
I think there's a couple things to think about in that. One is macroeconomic forces are inevitably already shrinking that pie, right? And we've been seeing this year over year in terms of the commercially insured population is declining, right? So revenues therefore are declining. We have a declining birth rate against more people aging into Medicare, right? So generally speaking, there are enough downward pressures on that general kind of pie, if you will, right? That we're all pretty familiar with. What I think we should be focused on is, okay, how do we, and kind of the conclusion of our findings this year is this concept of value optimization, right? How do we do more with less, right? Or just do better with what we already are working with, right? And we have a tendency to focus on profit maximization, right? And versus actually thinking about, how do we optimize all the factors that, cost, convenience, quality, safety, right? How do we what's the right permutation of those things, which might mean you might have to trade off a little bit on that revenue, right? So maybe an analogy to put this into perspective is, the Costco business model, for example, right? And I know it's not healthcare, but generally speaking, right, Costco as a brand and their kind of business model, they have a hard rule around the markup that they will do on all goods. I think it's 14%, if I remember correctly, right? So regardless of, if they get an even greater discount on the raw kind of product that they're getting from their wholesaler, they will, it's 14%. They're not going to go higher, not going to go lower. And all to say, their customers, their members know when I go to Costco, I trust that I'm getting the best deal possible, right? And so could Costco decide, on here, well, we got this for cheaper, so let's mark it up to 20% here, and let's do this, right? Like they could do that. Like that's what we're doing in healthcare, right? Let's just kind of max things out as much as we can to see what the market will tolerate, right? To maximize our revenues. But a model like Costco is being consistent. They're focusing on kind of the consumer experience, and the downstream of that business model is they're coming out ahead on revenue, right? The per individual transaction, they may be less revenue, so to speak, but that loyalty and that experience they're building because of that trust, we've all seen this. We all go into Costco buying more than we intended to buy because of how their model works, right? So it's a little bit of an analogy. There's a lot more complexity to it, but point being, when you talk about the pie, right, our mindsets need to be, how do we optimize the value that we're delivering to our target customer, even if that means we have to trade off on less revenue, based off what we're used to getting in X transaction, right? That's not how we operate in healthcare at all.
Yeah, and it also kind of feels like part of that message is focusing on that long-term relationship, because as you were pointing out, with the comparison to Costco, it's you create that loyalty in that, and knowing people who are Costco fanatics, it's, that is the place that they will go because there are so many, inherent factors to it that I don't, I think kind of, as you're suggesting, healthcare is not necessarily focusing on. But Sanjula, believe it or not, we're already almost out of time. So I'm going to close with one final question, which is, kind of given everything that we've been talking about, what has you optimistic about the state of healthcare?
Yeah, it's a great question and a tough question. I would say I'm optimistic that some of these new data sources that are starting to come out and have come out, and health and price transparency, I think is a really important piece of that. And the reason that's important, right, is this idea for so long, healthcare has been this black box, right? And so, payers and insurers kind of held that information to themselves. Now that information is transparent, right? When information is transparent, and then you figure out how to, make it usable, but you can start exposing these discrepancies back to the laws of economics and this idea of value. And so I'm optimistic that we're kind of are turning a page. Kind of maybe the next decade is, if we shift our focus, the last decade it was all about value-based payment and quality reporting, right? Well, what if we said the next decade is all going to be thinking about price and price variation, and start really focusing on that and the intersection of price and quality, right? Like not let's just look at quality in a vacuum, but now that we have this huge other piece, bring those two together.
So a lot to be able to track, and hopefully, start to see some positive movement. But, as I said, believe it or not, we're already out of time. I want to thank my guest, Sanjula Jain, for another great conversation today.
Thanks, Matt.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.